Iran's health ministry says the coronavirus death toll in that country now stands at 54. The number of confirmed infections is nearly 1,000. That's more than double what it was reported just 24 hours earlier. I spoke to Tehran-based journalist Sarbas Nazari and asked him if there were any signs that Iran could be on the right track battling the epidemic.
Iran is slowly gaining the upper hand, if not in treatment, at least in identifying the infected population. What the officials also found as good news was the announcement that at least 175 people have now been treated and discharged. Still, they have warned that the peak has yet to come and that they have to brace for even more. We understand that almost all provinces have now joined the club of the flashpoint and infected areas due to the tremendous cross-infection that remained unnoticed or perhaps underestimated in the early days of the outbreak. A health official said also that it's a long time before Iran announces victory, and it could even stretch well into May and June. But still, in the latest, we also heard from the Revolutionary Guards, the powerful force, that they are getting increasingly involved, and they are now speaking of their expertise in what they call this biological war.
What are the key challenges in terms of medical know-how and crisis management that Iran is now grappling with?
You know, there are reports of chaotic scenes in several hospitals, especially in the northern city of Rasht, as you had in your report, where the seriousness of the situation has now entirely closed the city's only airport. We have acute shortage of supplies and kits in those overwhelmed hospitals. But Iranian sources said today that 52,000 kits from WHO and 15,000 from China are arriving in the country. That could probably bring things under relative control because due to banking restrictions and international sanctions, Iran has been unable to purchase them. But aside from that, there is this disappointing fact about domestic corruption and profiteering. The health minister has issued a public letter to President Rouhani in which he had a lot of bones to pick with the system.